it doesn't work that well. These work really great. Okay.
Testing.
You get to play a game since you're helping with this. All right. Starting with a game for participation.
Ooh.
She's not paid to do this.
Nah, I wish I was.
Take this one.
Oof. Let's see.
Go ahead.
Did I open it?
Yep. Let's see what you got.
Free adjustment.
There you go. Woo!
Yeah.
And if you're really a good person, you'll pass it on to someone else, or you can take it.
Okay.
Yeah, you can gift it. Miss Amanda.
I might do that.
Yeah, give a little gift. All right.
Yeah, since I pay for the membership.
1, 2, 3, and action.
Action.
Hi, I'm sitting here with Miss
Amanda.
Amanda. I didn't even do that, so I didn't even get the name there. All right, check. Hey, we're here today with Mr. Harris, and this is
Amanda.
Miss Amanda. We appreciate your time.
Yes.
We're gonna get right to it. We are trying to let people know about Dr. Leslie and just how she differs from others. And instead of hearing me say it all the time, we appreciate other people giving their experience. So how'd you get here? How'd you even get here?
Like over a year ago, my back was hurting so bad to where like I couldn't walk. It was like that sciatic pain, and you walk, and it's like every time you take a step, you feel it. So found Dr. Leslie, and
where
at? Through a coworker.
Okay, coworker, good.
So they're like, hey, you should try out this. Hadn't been to the chiropractor in a while, maybe a little over a year. I'm like, okay, I don't know if it's gonna do anything, but I'll go ahead and give it a shot.
Correct.
I came, met Dr. Leslie right off the bat. Loved the personality.
Really?
She's just, it's humorous. It's humorous. It's like free entertainment. That's
one way to put it.
And then, so I was explaining. I think by the time I got an appointment, it wasn't as bad, but I was explaining like what I was going through. Came in, I did use the voucher. Okay. And so I got my x-ray done. And when she looked at my x-ray, she was like, oh my goodness. She was like, your neck is going the wrong way. And yeah, and she's like, I see it. So we went from the x-ray room into the adjustment room. She adjusted my back, and the first thing I was like thought of as like, what is this lady doing? Like, because it's not the average adjustment I was used to.
Right.
Usually when you go to places, any chiropractor I've been to, I went from a family chiropractor to other chiropractors to chiropractic membership places, and I've always been adjusted the same way.
Okay.
So when I'm sitting there and I'm feeling her fingers like almost like counting or something, and I'm like, okay. And so she adjusts me. I'm like, wow, this feels really good. And I ended up telling her, I was like, I've never had
someone touch you like that before.
Yeah, like it was just like different. Like the adjustment was different. I've always been like used to like laying down and my neck cracked, and this one, like I sit in the chair and my neck gets cracked.
Right.
It's just,
it is usually laying down. Now that I think about it, I didn't even think about it because I've been doing this so much this way.
It's
now you said,
and when she goes to crack your neck, you feel like her fingers counting or something, like, and she's like, all right, here, okay, here, and I'm like, all right. So so it's more of a personalized adjustment.
Whoa, buzzword! Not personalized care is one of our buzzwords. Yes. Personalized care versus drive-through service. So you hit that word without me even saying anything. Good job. Ding, 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 ding.
But it's like
you win a paperclip.
4 paperclips. Ooh.
There you go.
But yeah, so it was personalized. So it was like she felt okay, like, and I asked her, I'm like, I've never had an adjustment like that. And she goes, well, why am I going to crack something that doesn't need to be cracked? Why am I going to adjust something that doesn't need to be adjusted?
Correct.
So
makes sense.
Yeah, so it's like targeting the areas that she feels that need to be. Yes. Yeah. So I was like, wow. Right off the bat, I was like, this is great. This is great.
And how long have you been coming here? It's been a while then.
A little over a year.
A little over a year, okay. Yeah. All right, thank you for that.
Yep. And so I did the membership because I was like, my back needs this. She was like, you should come, like, keep getting, just because with my anxiety and I always have stress, like, it's all really just stress induced.
Yes.
But when I talked to her, it's like maintenance is like one of the biggest things. And I think I talked to you or I talked to somebody. It was like, well, if you think about it, when you go to a specialist, you pay probably what, average $50.
We talked about that. Yes, you did.
And I was like, well, if I come once a week, it's like when I'm paying my membership, I'm like, I'm only paying less than $40 a visit.
Right.
I was like, and I come, I get adjusted, I get the sauna for
Right.
30 minutes, and I get to watch my show while I'm in there.
Yep.
And I get the vibe plate.
And you get the
I
vibe
was
plate.
like, so it's almost like a mini spa thing because it's like regular chiropractors, you go and you're in there for like maybe 10 minutes, you're in and out.
In and out.
In and out. And when I come here, it's like, yeah, I mean, my adjustment may be less than 10 minutes, but then also the experience while I'm here, the sauna machine, the amenities that come with it makes it worth
Vibe
it.
play, the roller bed when it's working,
The entertainment,
yeah, that lets do.
So
the water machine, we always keep water up front.
Yep, teas, the honey packets.
Honey packs.
Yep.
Not that honey pack. The actual the actual raw honey.
Yes.
Okay.
So so I was coming here and I'm like, okay, I'll do the membership.
Right.
So, and then while I come for my adjustments, I'm like, something's hurting, something's this. And she'll evaluate it. She'll be like, all right, let's try this.
Right.
And there's been times where like I've come in, I'm like, she's like, what's going on? I'm like, I can't move my neck. And this was literally like, I think 2 weeks ago. I think it was on a Tuesday. The office wasn't open. And I'm like, okay, I gotta make it 24 hours. And I think I actually ended up coming in earlier that day. And Valeria at the front desk was like, are you okay? I'm like, my neck hurts. So she adjusted it and I started like over an adjustment and she was like, your neck was locked in 3 places and your ribs were out of place.
Your ribs?
If I'm not wrong, I'm pretty sure she said my ribs.
He said I'm not wrong. That's the first time I've heard that, but go ahead. That's
So, but I tell you what, I walked out of here and I was able to move my neck. Yes, it was sore, but I'm like, that's to be expected. Right. I mean, my neck was just in pain.
It was one way, and then it got cut back, and then another way.
So, but I went into work the next day, and everyone was like, "Wow, you look so much better." I was like, "Yeah, Dr. Leslie, I swear." Like, and then what was it, a few months or maybe when I first started coming, my neck got out of place, and she did the Softwave, and I was like, "It's just I don't use the Softwave like consecutively, but if I'm ever in pain, my knee, my neck, was one time, I think it was my foot, and I'll do like one treatment of it. I'm like, okay,
one treatment to get you. If you get it early enough,
yeah, like right when it starts hurting.
Yes.
And that's why I love coming weekly because it's like maintaining my body.
You can catch it early.
Exactly.
Because I do my feet, same thing. My feet will flare up, but obviously I can come and just knock it out the next day. I don't do the normal protocol.
Yeah.
But I also catch it like literally right when it starts bothering me. I do one treatment, I'm good for like 2 months. And then it'll flare up again. I just come do it again. Yeah.
But then I don't need to do like the back to back. So yeah, I just now I tell Dr. Leslie, I'm like, it's my adjustment therapy, like spa.
Right. And just because, when you come in weekly, let's say you have stomach issues, like she will listen to you and offer stuff that's outside of what you may be coming for that day, and just be like, oh, you got, like you were saying, because you come, even if it's not weekly, monthly, to be able to say, hey, you know what, I've been having this issue going on, to be able to say that and get some type of recommendation. Yes,
she's done that, and she's like, well, have you gotten blood work? I was like, yeah. And again, all this is while I'm getting my adjustment done.
Correct.
And it's like, oh, well, they said this and this. And she's like, okay. She goes, well, I suggest this. And it's not like she's like, you need to start taking this. It's like, you need to start taking this because, and she'll explain it
Correct.
to where it makes sense. So I'm like, oh, okay. So like, what is it? October last year, I got blood work done, and I forgot the name. Westgate. My levels were really low in the red, and she's like, oh, because your body's inflamed. So she got me taking the iodine drops and stuff, and I was like, okay, but what are we looking at? This is going to cost like, what are you trying to get me at? And she's like, no. And she's like, listen, I could suggest all of this, but I'll tell her, I'm like, well, this is my budget. This is what, and she's like, okay, well then if I'm gonna suggest anyone, this is the one.
Right.
Like, so she kind of works with me. I'm like, I can't afford this, or you know, she's helped me find, you know,
substitutes and things like that.
Yes. So to make it affordable for me, for us people that don't got money.
Yeah, like us.
Yeah. So
it's most people. And that's
it's
why
it's honestly, yeah.
That's why we're creating the platform on Patreon, because a lot of people just need to be pointed in the right direction. People are going months, years, and it's like no one's even pointed you
because they think it's expensive.
Right. And plus they go to their doctor. The doctor says, hey, you're within range, take this pill. Like the last young lady that was in here, she worked in the medical field. I didn't even know that. She was in medical field nursing for 10, 12 years. I didn't know that. And she was like, yeah, I can tell you based on my experience, they only want to really care about the symptoms. So if you come in complaining about this, whether it's hair loss, sleeping, irritation, urination, anything with an Asian on it, they're going to help you with the one thing you told them about. And most people are so tied up with work, money, responsibilities that they're like, all right, you're going to help me with the problem I said I had? Solutions met. When they're not realizing that it started somewhere else, probably. Yep. That's just the way your body's telling you that there's a problem.
Yep.
But they come in, they have a little bit of time, a little bit of money. Let me just get what I need to get and get the hell up out of here. And it's just
putting a Band-Aid on the problem.
Correct.
So yeah, I was actually glad to get my blood work back and see that some of my numbers are looking good.
So you've had more blood work since the first one?
I just got them done last week.
Congratulations.
So I don't have all of the results back, but from what I'm getting back, things that were low are looking good.
Okay.
So it's been a good journey. I
appreciate you.
I like it.
Okay.
So
well, thank you, Miss Amanda. And stepping into the pod is called The Waiting Room. So we want to say thank you for stepping into our waiting room, our virtual waiting room. And thank you for giving us some feedback. And she is an active member of the team.
I am.
And she been about a year?
Over a year.
She's been coming for over a year. And she has insurance, but she sees enough value to come here, see Dr. Leslie, and get her therapy and stay maintained. It's okay to treat yourself.
It is.
Or treat yourself good.
I do it more for the entertainment.
And
no,
that.
I'm kidding.
And that.
No, but it has
Stay entertained
helped.
at Patreon, thewaitingroom.com.
Yeah. It's been great. I love it.
Well, thank you very much. Until the next time.
Yes.
See, it wasn't too bad.
Thanks for my fidget toy.